Ever wondered what canine leptospirosis is? Well, you're in for an enlightening journey. Canine leptospirosis, often shortened to lepto, is a bacterial infection that can pose serious consequences in dogs. Leptospirosis is caused by multiple strains of bacteria called Leptospira. Leptospirosis is found in almost every corner of the globe, but it thrives in warm, moist environments. Lepto is spread through the urine of infected animals, primarily rodents and small mammals. A dog can contract the disease by drinking, swimming in, or walking through contaminated water, or by consuming contaminated food. The bacterium subsequently enters the dog's body through the skin, particularly through open wounds or through mucous membranes of the mouth, eyes, and nose. Once the bacteria multiply and spread throughout, the dog may not exhibit any symptoms for a while. This incubation period, the time from exposure to the onset of symptoms, is typically about 1 to 2 weeks. However, it can vary depending on the virulence of the strain and immunity of the host. This stealthy nature is what makes lepto so perilous. Further compounding this peril is the fact that lepto is a zoonotic disease, meaning it can be transmitted from animals to humans. So what are the signs that a dog might have lepto? Symptoms can vary greatly, but common ones include fever, muscle pain, vomiting, diarrhea, loss of appetite, lethargy, jaundice, and in severe cases, kidney and/or liver failure. Diagnosing lepto can be a challenge because clinical signs may resemble other diseases. It often involves blood tests and urine tests. Depending on the results, additional testing may be used, such as a PCR test to look for DNA of the Leptospira organism and testing for antibodies. Chest X-rays may also be recommended to look for pulmonary hemorrhage. But don't worry, with a swift diagnosis, treatment can begin promptly. Treatment for lepto usually involves antibiotics to kill the bacteria, along with other supportive treatments to help manage the symptoms. This could include fluids to prevent dehydration or medications to control vomiting and diarrhea. In severe cases, hospitalization may be necessary. Now you might be wondering, how can we prevent our furry friends from contracting lepto? Vaccination is the primary method of prevention. Regular vaccinations can significantly lower the risk of infection. Additionally, try to avoid areas where the Leptospira bacteria might thrive, like stagnant water or muddy fields. To sum it up, canine leptospirosis is a bacterial disease that can be contracted through contaminated water, soil, or food. It can cause a range of symptoms from fever and muscle pain to kidney or liver damage. Diagnosis can be tricky, but once confirmed, treatment with antibiotics and supportive care can begin. Prevention is key, with regular vaccination and avoidance of high-risk areas being the best ways to protect your dog from this disease. Remember, knowledge is power. By understanding canine leptospirosis, we can take steps to protect our dogs and ourselves from this global bacterial threat.